Hi, welcome to the companion video. This is a bit of instruction for COVID recovery and healing breath sequence. My name is Ken Kloes. I'm a licensed registered respiratory therapist, registered polysomnographist, which is a sleep technician, and also a certified yoga instructor. I've been doing that for about 13 years. The purpose of this sequence is to maintain lung capacity, even increase lung capacity, stretch, expand and strengthen muscles of breathing. And also, if there's some secretions in the lungs, this helps get the secretions out of the lungs, as well as peace in mind, body, and spirit through some relaxation techniques and just doing the yoga practice itself. Now, the main focus of this series is those recovering from COVID-19. It's a respiratory disease that can have some long-lasting effects. With COVID-19, often people will have shortness of breath, some anxiety, and these can linger and last for a while. So what we're trying to do is maintain as much lung capacity as we can, even increase lung capacity. If there are some secretions in the lungs, let's get those secretions out. And also just some peace and relaxation with the deep breathing that we're doing and the stretching and strengthening of our muscles of breathing. Now, COVID-19, some of the main features or things that are affecting people is the virus as it gets into the lungs in particular. What our immune system does is it needs to attack that virus and get rid of it. So the virus actually encapsulates, or our immune system encapsulates the virus, kills it. The problem is that encapsulation can stay in the lungs. And the more of that encapsulation that we have, it creates masses in the lungs, which actually reduce lung capacity. So that with exercise or movement as we're recovering, we can feel short of breath because we actually are short of breath. So that's what we're trying to do. We're trying to address that. And really, if you have asthma or COPD or recovering from a cold, all of these concepts would also apply. Now, just a little bit of anatomy here will help. So basically, the main muscle of breathing is the diaphragm. It separates your lungs from your abdominal organs. When you breathe in, the diaphragm goes down, creating more space for the lungs. It's actually negative pressure that's pulling the air into your lungs. Upon exhale, the diaphragm moves up, and this squeezes the lungs, positive pressure, forcing the air out. In addition to the diaphragm, we have other muscles they're called accessory muscles, but the muscles between the rib cage, the intercostals, and muscles in the shoulders and the back, where when we bring our shoulders up to breathe, this can actually help breathe because it gets the arms out of the way so the rib cage can expand and you can get a little bit more air. Now the lungs themselves, this is really the main feature. You have small, medium, and large airways. So your trachea or your windpipe, that's the biggest area. As that comes down, it breaks off into two bronchi, the left and the right. And then those bronchi break off into bronchioles, and they get smaller and smaller and smaller. Finally, at the end, we have air sacs, kind of like you could think of them as like grapes. So those alveoli, that's actually where the gas exchange happens, where oxygen goes into the blood, carbon dioxide comes out. Now, fascinatingly, we have about 600 million alveoli on average. And that surface area, if you were to spread that out, it would be the size of a tennis court. So lots of area to exchange gas. But if you think about in COVID-19, when those masses create and it starts to block off some of those alveoli or the bronchioles, that tennis court, instead of being a full tennis court, it's only like half the tennis court, or a third, or a fourth. So as that gets smaller, not as much possibility to exchange air. So shortness of breath, hard to feel like you're getting in a good breath. And the bronchioles, they're just airways to the alveoli. So really the alveoli, that's like sort of the main feature. So this sequence is all about that. Let's get that stuff out of the lungs. Let's stretch. Let's do some strengthening and relax along the way. The first pose in the sequence, this is the Bikram breathing or breathing technique. Or you just bring knuckles under chin. Sit up straight in a chair. You could also do this on the floor, but here I'm just going to demonstrate in a chair where feet are flat, spine is nice and long. And on inhale, breathing in through nose, you just lift elbows up, keep your shoulders down, fill lungs up as completely as you can, and on exhale, just sigh the breath out mouth, and you're bringing elbows in towards each other, just dropping your head back, a little bit of pressure on the chin. Pull belly in, squeeze all the air out, and then we just repeat this a few times. Inhale. And exhale. Breath in. And out. We'll do two more. Arms down alongside body. Shoulder shrugs. Let's work some of those accessory muscles. Working the upper, mid, and then the lower back, right down by the lower tips of shoulder blades. So we start with the upper back. On inhale, these shoulder shrugs, you bring shoulders up by ears. Now draw shoulder blades straight back. Squeeze shoulder blades together. Exhale, drag shoulder blades down. Inhale, shoulders up by ears. Straight back. And exhale, drag down. One more, shoulders up by ears. Straight back. And down. Now mid-back, right between shoulder blades. Inhale, shoulders come forward, opening up upper back. Exhale, squeeze shoulder blades together like you're grabbing a pencil, and then drag that pencil down. Relax shoulders, inhale into mid-back. Squeeze, and drag down. One more, big breath in. Lower tips of shoulder blades. Elbows in against side. Palms face up. Inhale. Bring pinkies in towards each other. Exhale. Just elbows or stay in. Just bring hands out to the side. Thumbs towards the back. Squeeze lower tips of shoulder blades in towards each other. And just a little drag down. Maybe like a ½ inch. Inhale. Pinkies towards each other. Exhale, thumbs back. Squeeze, drag down. And inhale. Exhale. Hands on knees. Now, cat-cow. This will help to stretch the spine, the shoulders, the neck, the low back. You can do this sitting or on the floor. Inhale, open chest. So you bring chest forward, hips tilt forward a bit. Big breath in. And on exhale, let's round spine towards the back of chair. Chin to chest. Inhale, chest forward, open up. Big breath in. Exhale it out. We'll do 2 more. Sit up tall. Side stretch. This is working on stretching those muscles between the ribs, those intercostal muscles. And as we stretch those, this will allow more room for ribs to expand. And if you remember, if we can get the ribs to expand more, we can get more breath, because the lungs, they could expand a lot. And they're basically restricted by your rib cage. So let's go, just bring right hand on the chair. Inhale, bring left arm up, and just leaning over to the right. Now pressing left sit bone down as you reach up and over. And take a bigger breath into the left lobe of lung. Expanding ribs, stretching the intercostal muscles. We'll bring that left arm down. Other side. So just left hand grabs the chair. Inhale, right arm up. And just leaning over to the left. If you want to look down towards the floor, that's actually a little bit of a neck stretch. Or you can look forward, bringing left ear down towards left shoulder. Either way, whatever feels good on the neck. Just feel that wonderful space that you're creating along the right side, even down into your hips. And we'll come on up. And one thing about COVID-19 is there's another, tends to be a lingering system for many, even if not just people that had it a severe case or even a moderate case, but they're finding even a mild case of COVID-19, there's this thing called a brain fog or confusion. Like it's difficult to focus on a crossword puzzle or a TV show or work. And they can't really quite explain it yet, but it seems to be quite prevalent, this whole brain fog. So we're throwing in a spinal balance routine that just makes you think a little bit, makes you focus and concentrate, just to see if we can kind of fight through that brain fog a little bit. So it's opposite leg, opposite arms. So you can lift the left leg up, right arm forward, and we'll just reach left arm out towards the side. So using both sides of the brain, that makes us think a little bit. Just keep your spine nice and long. We'll come back to center. Lift up right leg, left arm out, right arm out to the side. Come back to center. Then we get complex. So it's just left leg, right arm, left arm. Just come back to center, trying to stay nice and balanced here. Not a whole lot of wavering. So we're working on the core by just keeping belly pulled in. If you want to get real fancy here, you can, even straighten the leg out. Add a little hip flexor. And then we can get real fancy. Do all kinds of stuff. Just trying to stimulate the brain on both sides, fighting through that brain fog. The pinnacle of this series is autogenic breathing. what this does, it does a few things. It helps to get the fluids out of the small part of the airway, the alveoli, bring it up into the bronchioles, the mid-size part of the lungs, and then the bronchi, and really out your windpipe. So it's trying to move the excretions, if there's secretions, mucus, up and out of your lungs so that you can breathe a little freer. And also, if you remember, our immune system attacks a virus by creating these little encapsulations and blocking off portions of the lung. What we're trying to do is we're trying to get the air in through that and maybe behind it to see if we can't recruit or open up some of those blocked off areas of the lungs. At the very least, let's get the secretions out. Now, the breathing for this, it's very particular. When we're doing it, you breathe in through your nose, pause for 2 seconds, if you can, 3 seconds if you could, but 2 seconds will do today. On exhale, it's an extended sigh. It's a sucking belly up and under rib cage. Now, the reason why we're exhaling slow and inhaling slow is, in particular, when you exhale fast, you actually close off those airways and you can't get as much air out. We want to move maximum amount of air in and out. So it's a slow inhale in, slow exhale out. Working lower, mid, or small, mid-size, and large part of lungs. So let's bring right hand on chest, left hand on belly. Now your belly, when you're using your diaphragm to breathe, it moves down in the belly, your belly goes out. So that's what belly breathing is. So to start though, let's just take 2 big breaths just to settle into this. So big breath in through nose. Hold for 2. And extended sigh. Do another one of these. Big breath in. Exhale it out. Let's work those small airways. So take another breath in as we set this up. And then try to exhale out as much breath as you can. Suck your belly up and under rib cage. And then taking in a normal breath, just using your belly. Pause. Now exhale that out. Just use your belly. Inhale. Normal breath. Exhale. Inhale. Exhale. Now, if you feel some crackling or hear some crackling, that's good. That's some of those secretions that you got the air in behind the obstruction. It's starting to move out, and we're moving it into the middle part of the lungs. So resist the urge to cough if you have that right now, because we're going to move that stuff up and out. So let's get into the mid part of ribs and the mid size of lungs here. So a little bigger breath in now. Belly goes out. Feel the mid ribs, maybe even an expansion out to the side as you breathe in. Hold it. Exhale that out. Exhale out as complete as you can. Just move those secretions. Resist the urge to cough if you have that. Inhale. Exhale it out. One more, a little bigger than normal breath. Exhale. All right, so we're almost there. Now the secretions are in the middle part of the airways. Let's get them into the big part so we can cough it out, or just keep working on, this is maximum expansion of lungs and ribs that we can get. Here we go. Big breath in. Use your accessory muscles. Shoulders can go up, open up chest. How much air can you bring in? Pause. And let's let it out. Big breath in. Last one. Exhale it out. Good. Now, if you need to cough, like a little huff cough, like a, if that can get the secretions out, you do that. Or if you need to take a big cough, it's okay to get a big cough in. And you could actually repeat this a few times. If you have a lot of excretions in your or secretions and they're starting to come out, but there's some left, just repeat that autogenic breathing a few times and see what you can get out. Maybe get those lungs clear. A spinal twist. Right hand on the chair, left hand on the outside of right knee. Keep your spine nice and long, and you can even take a nice deep breath here. Still working on those intercostal muscles, stretching rib cage. Come back to center. Left hand on the chair, right hand on the outside of left knee. Just twisting towards the side. We'll come back to center. Let's do this a few times. Keep your face nice and calm. Working on peace of mind. Now, it may feel as you're twisting that the lungs are constricted and you can't get a big breath in. And of course you can't, because you're not allowing the diaphragm to move down as much as it could to create the space. There's some restriction with the skin as it is wrapping around your body in this twist. But if you can take a deep breath here, it's like trying to open that up even more so that when you're not twisting, you can take an even bigger breath. Let's just stretch the shoulders and upper back here. So right arm forward. Just draw that right arm across body. It's not a twist. And as you pull on the arm, you can resist with the arm at the same time. It's a somewhat of an active stretch so that we're strengthening through the shoulder as we're stretching shoulder, working on those accessory muscles of breathing. Right, left arm out. Let's just draw that across body. Pulling on the arm, resisting at the same time. That felt pretty good. Let's just do that one more time. Right arm across body. You can feel the right shoulder blade moving away from left shoulder blade. And we'll get to the other side. Just draw the left arm across body. Now, shoulder shrugs here, just visiting this again and not worried about mid and upper back, but you know, it just feels good just to move shoulders. We've been doing a lot of work here. Focused. And this is just trying to get us to relax a little bit. You can drop chin down towards chest. Just a little bit of a neck stretch might feel good. I even like to just bring hands on the chair behind and just Squeeze shoulder blades together, maybe drop head back, stretch through throat. Now one more pose before our Shavasana. And this is like an expansion breathing exercise. And we'll do this with a mantra. So the mantra could be something as simple as breathe in, breathe out, or in, out. Or maybe something a little more healing like just heal. Or pick whatever mantra feels good for you. Or you could just focus on your breath. If you don't want to think about a word, just focus on the sensation of your breath. Here we go. Let's do a couple together. And I'll say what I'm thinking, just so that you have an idea. So in. Bringing arms up and out, or up and maybe together at the top, and then out. Arms come down. We'll do it again. In. And out. Or if your mantra is just, heal. Or even better, I am as I am. And just, you can fold hands in lap, just touching thumbs together. Close your eyes. Just feeling feet flat on the floor. As you just taking a few breaths in and out here. You could continue with your mantra. Or maybe just notice the sensations of your breath as you breathe in and out through nose. Peace in your mind and body. Let's just bring palms together. Thumbs right along the center of chest, along sternum. Well, you could stay here and just continue to Shavasana or meditate for a while if you choose. Namaste. Now this instructional video, it was more detail. There's a companion video, which is just simply the sequence, and it's about a 15-minute sequence when you just do the poses. A little less instruction there. So this instructional video is really designed to kind of explain what we're doing and why. And then if you want to do this as a daily practice and you're tired of hearing me talk, you just do the practice video. So 15 minutes a day. What an investment in you. Thank you.